I don't understand why I have to have this procedure. I've done everything right. I followed the doctor's directions. I've eaten well, I've exercised, I've taken my anti-clot meds. I'm really scared.
Unfortunately, since this is a progressive disease, even though you followed all of the directions to the T, sometimes the surgical intervention is still necessary. And to prevent it from getting any worse, we still need you to make sure that you're doing the diet, the exercise, and your medications even after you're back on your feet.
Keep in mind that we will be clearing blockages today. However, there is a high reoccurrence in other areas of the legs for blockages again. So that's why it's really important for you to just make sure you stay on the regimen that you've been on for the last couple of years.
So does that mean that I'm going to have to have it again?
Well, we can't give you 100% yes or no on that, but we can let you know that a lot of patients do have repeat procedures in different areas, sometimes for the same one.
Do you know which procedure you're going to do on me?
Well, we truly don't know what we're going to be doing until we see how occluded the actual artery is. We'll send you down for a scan, and depending on the results, we'll either do a bypass or perhaps a minimally invasive procedure such as a stent.
What's a stent?
Well, a stent is a tiny metal cylinder that gets threaded through the arteries, and it holds the plaque open, makes a pathway through it, and lets the blood flow continuously down through the rest of your leg. Balloons also can be used to squeeze a hole through that blockage. We do prefer the stent.
So how do you get it in my leg?
Well, normally we'll put it through the groin, sometimes the wrist, and we utilize a wire that has the capability to thread the stent or even a balloon on the end of it down to where the blockage is.
Now remember, we might have to do the bypass instead. This procedure is going to use a vein either from you or a synthetic vein, and we attach it above the blockage and below the blockage to create a bridge to allow the blood to go around that blockage to get flow to the rest of your leg.
So when will you know what procedure you're going to use?
Well, we're going to run the tests and come back and discuss the way to treat this surgically. In the meantime, here's some information about the different options.
Thank you.